Dental veneers. Well, dental veneers are really a term that really reflects a new facing on a tooth. So sometimes we're faced with a situation where a tooth might be quite heavily restored, usually the front teeth. Maybe we want to make some shape change, maybe we want to make some colour change to those teeth. So typically in cases where teeth are worn, they're short, they're chipped, they're broken, we start thinking about the use of a ceramic material preferably, or even some composite resin materials as in a veneer preparation, which provides us a new facing for the tooth. The treatment process for a dental veneer is not too dissimilar to having a filling. I mean, a dental veneer is pretty much a glorified filling. It often is made by a laboratory technician in the case of a lab ceramic made material, but it can be made other ways as well in the office here. But the process really starts with the cosmetic planning. I mean, normally we're doing veneers for aesthetic dentistry to rebuild worn, chipped or broken teeth. We need to have an assessment of how many veneers do we need. Do we just need one? Do we need to do the front 6? Do we need to do the front 10? It does depend case by case as to what we're trying to achieve. We need to have clear instructions for our laboratories or even ourselves on colour matching and shape, and we often do a lot of careful planning, usually digital planning now with the technology we've got available to us, to really make sure we're happy with that before we start doing anything. So one of the most important parts of planning a dental veneer case or an aesthetic makeover or smile makeover case is what we call a smile test drive. So it's a position where we can take scans and special digital photos. We've got some software to help us build the teeth to where they need to be in your face, not so much in your mouth, but in your face. So facially generated treatment planning now is what we do with aesthetic and cosmetic dentistry. And it's a very, very important part to get everyone's expectations right. As a clinician, we want to make sure that we've got things in a place that we think things need to be, and we've got to most importantly make sure that our patient is happy with what we've planned. And the way we do that is the smile test drive. So we've got a way in which we can look at, for the majority of cases, is look at the way we've planned a case, and we're able to do this with a trial in the mouth with just some tooth coloured material that we're able to put on the teeth to give us a bit of a preview as to where we're headed with the case. And it's there is the first step before we even start doing anything at all. We've got to make sure we're happy with that. From there, the conversation becomes about the choice of material to actually make that happen. So what types of dental veneers can you have? Well, there's typically and historically two types. One is a ceramic or a porcelain veneer. The other is a composite resin veneer. In the modern day, there's a few different ways that these can be manufactured. So historically, porcelain and ceramic veneers, and even still today, we get our master ceramists to make those for us. Now, those types of veneers are the most costly, but they are the highest quality. These guys are very skilled at layering ceramic and colour and shape and surface texture of these veneers to make them look real. They're the highest quality veneers that we feel that we can make. They're the strongest. They're probably the ones that we think are going to last long. At the other end of the spectrum, we've got composite resin material. Now, composite resin material can be directly laid on your teeth in the mouth, but that process is subject to what we call polymerization shrinkage, where the material itself starts shrinking the moment it's cured. And a lot of you have probably been to the dentist where you have a filling and you have the blue light put on your tooth to set the material that's been placed to restore a defect or a filling or whatever. So that process works very well. Those veneers will look okay, but they'll only look okay for a much shorter period of time. Resin's a porous material, so it does collect stains, etc. And because of that polymerization shrinkage that happens over time, those veneers do tend to fail a bit quicker. But, you know, they can be a very cost-effective way of making aesthetic change for the teeth in the short to medium term. In the modern day with CAD CAM dentistry, and we use scanners and milling machines and 3D printers, etc., we can make both composite resin veneers but also ceramic veneers with our CAD CAM milling units in the surgery. So we would never say we're as good as the master ceramists at this end, but it is much better than a composite resin veneer at this end. The polymerization shrinkage has already happened in those materials in the milling blocks, so we overcome a big hurdle with the composite resin direct to tooth option at the bottom end of the scale, but still having resin in its mix is still subject to longevity issues. Those veneers still look very satisfactory and look very good. They will last longer than direct composite veneers in my opinion, but still those materials are substandard compared to the ceramic ones. So I suppose the modern day dentistry, the great thing is it gives you lots of choice and lots of options. So sometimes people come in to see me and thinking and maybe even wanting dental veneers to improve their smile, and I think sometimes if your teeth are in very good condition and maybe they're a little bit crowded, maybe some of the teeth are a little rotated, maybe there's just a few things that are off with them. What everyone's got to understand about dental veneers is that it's almost always an irreversible procedure. We've got to prepare teeth, we've got to remove tooth structure, which is irreversible, and it commits those teeth to having a veneer for the rest of their lives. And sometimes that's not a great idea, particularly if your teeth are really in good condition. Maybe they're just a bit out of place. Maybe they just need a bit of colour change. So, you can certainly think about some orthodontic treatment, this day, particularly for adults. We do a lot of aligner treatment. You might have heard of Invisalign or Sure Smile. There's some great aligner options out there for patients just to put your teeth in a better position, and sometimes that's a much more conservative approach to making cosmetic change, and it's much more enduring too, because we're not doing anything to your teeth that's irreversible. The other thing is about tooth whitening too. Sometimes that just can really brighten and freshen things up, and that's a very non-invasive approach as well. So veneers aren't the be-all and end-all. Everyone's got to understand the fact that that's an irreversible process for the most part. And you just got to understand what you're getting yourself into.